Thank you very much. We wish to thank the NACCW for this opportunity to be able to share the study that Nokwanda conducted for her master's degree. While we're still here, perhaps one needs to correct what was written in the schedule. She was depicted as a person who is a lecturer for child and youth care. She is a graduate of child and youth care, and she is the master's graduate for the health sciences degree. At this moment, I wish to acknowledge Prof. Sibia, who is now the DVC at the Durban University of Technology, because she was the main supervisor and I was the co-supervisor for Nokwanda. Next slide, please. The title for Nokwanda's study was Professionalization of Child and Youth Care. We have decided to put this title in context by adding the next phrase, which is bringing hope and defeating challenges in child and youth care. Next slide, please. Because she was the main. We saw this quote, which is actually in the at the beginning of the thesis, the master's thesis, Nokwanda's master's thesis, and it befits what is happening at the present moment in terms of professionalization of child and youth care. This is a quote that was in one of the speeches, which was said by Leslie Dutoit, who is one of the pioneers of child and youth care in South Africa. The quote goes like this, open quotes. Firstly, we believe in what we are doing. We do it well. We receive specific training for it. And we want to be recognized both professionally and with respect to salaries. We want to earn what social workers earn, for example, and we take our place within the professional multidisciplinary team without being patronized or disregarded. It's so interesting that this quote was true then as it is true today. Next slide, please. The aim of Nokwanda's research was to assess the perspectives of child and youth care workers on professionalization of the child and youth care profession. Maybe it's good to just define some concepts in order for you to understand the study as Nokwanda is going to describe it to you. Professionalization includes education, training, and other activities that convert a worker into a professional, and that could be in any other profession. And it also includes the social procedures by which an occupation becomes a profession. The literature review that describes professionalization has got some elements that are common. And these elements are education and training, registration and certification, national associations, knowledge and skills, values and ethics, attitudes and beliefs. It's interesting that today we are in a conference that is being coordinated by a national association that has made us to be professionalized and to be professional child and youth care workers. We know that in child and youth care, there is a gap in terms of the literature review. And anyone who is doing studies in child and youth care in South Africa will attest to the fact that actually the discipline of child and youth care doesn't have much literature. And in that note, I would appeal to child and youth care workers who are here to create literature for the field so that the child and youth care workers who are coming behind us can be able to have some literature from the scholars who are born and bred in South Africa. Next slide, please. The work was directed to specific parts, to specific scholars in child and youth care, both abroad and locally. She was encouraged to use the work of Van der Ven, Stewart, Ward, Freeman, Thelen, and Mattingly. She was, in terms of South Africa, it's lucky that we do have a few writers in child and youth care who have just emerged. And therefore, she used scholars like Molepo, Delport, Lodge, Jamison, Thambadu, and Ngonyama. All of this literature was the literature that was showing that in terms of professionalization in South Africa, we are moving to greater heights. Because in the past, there used to be no literature at all which determines child and youth care. Now I'm going to give Nokwanda. She's going to take you through what she has done in her study, and she's going to be showing you the theoretical framework that underpins the study and the methods that she used and the analysis, and she's going to be telling you about the findings. I'm sure you're waiting eagerly to hear what child and youth care workers in South Africa say about professionalization. Nokwanda.
Thank you, everyone. I'll be taking you further on the theoretical framework till the end of our presentation. Okay, this study that I had conducted, it was underpinned by the professionalization model of Foyt and Danisois from 1985. It's a model of professionalization. This model was relevant to the study because it includes, the model speaks about the essential, the exclusive, and the complexity of a profession. So this model was a general model. So I thought it would fit perfectly for child and youth care profession because it's a very general model. Any profession can apply it to their profession and see where it takes them. The most important thing that I liked about this model, it speaks about the public evaluation and the status and the formation of a profession. So the formation of its autonomy. So it's clearly helps a profession to where they are in terms of professionalization. Are they meeting their professional aspects, or they still need to actually build up towards that? So this model was very helpful in that, and it helps with actually understanding the level of professionalization we have in child and youth care in South Africa. For the research methodology, this was a qualitative, exploratory, and descriptive conceptual study. Meaningful information was gathered from the participants who are for the CYC professionalization. That's the topic. Our study my study setting was the 3 child and youth care, or children's home rather, that were selected in Durban randomly. The population of the study were child and youth care workers from Ethekwini, KwaZulu Natal. Okay, when the study was conducted, the South African Council for Social Services Profession in 2020 had revealed that by 29th June in 2020, there were 91 professional child and youth care workers, 7,376 auxiliary CYC workers, 1,504 CYC workers from FET colleges, and 205 students from universities that were registered. So these are the registration statistics that we had from the South African Council for Social Services Professions in 2020. The sampling process and sampling size. The purposive sample was used to select the professional child and youth care workers from children's home. And these child and youth care workers, there were 12 in total, and they were chosen from these CYC centers because they had received training and education in CYC. Okay, our inclusion criteria: CYC workers in children's homes in Ethekwini, KwaZulu Natal, between the ages of 24 and 60 years, both males and females from different racial groups who have a qualification and training in child and youth care. In-depth interviews were conducted using semi-structured interviews with open-ended questions to collect the data. Hence, it was a qualitative study, so the CYC workers were given an opportunity to express as much as they can. Okay, the data that was collected for the study, it used the 8 steps of TEACH method of analysis, which goes through reading through the transcript, writing key features from the data, making a list of and grouping topics, abbreviating topics into codes, using descriptive wording for topics, grouping related topics together, making preliminary analysis of data, and recording the existing data. I think this is the part that everyone was excited and was waiting for mostly. So before I actually go deeper into the findings, I think it's very relevant to actually hear the voices of the participants of the study before actually trying to explain all the themes that had emerged in the study. Okay, the first one, it goes like this, open brackets. I think they do not know what they were doing. Sometimes they were doing the job for the sake of doing it. It was not actually helping the child or the young person. The second one, so the skills that we're lucky enough to receive under this profession, I can say that they are helpful and unique. They're not like other professions, but they stand out on their own. We work in the life space. That's what makes us so different from other professions. The other ones, the last one goes like, I heard that we are being professionalized. And as child and youth care workers, in my mind, I thought recognition, I thought salary increase and being part of a certificate. And even the qualification is all over, and that all the universities and institutions can understand child and youth care. Someone might be asking, why did I just go straight to the verbatives? It's because you could, when I'm actually explaining the findings, you would actually understand where all these verbatives are coming from regarding to the actual questions that I had asked the participants. There were a lot of themes that emerged, mostly 5 of them. 5 themes emerged from this study, but for the purpose of this conference and this presentation, I picked the 1st, the 4th, and the 5th theme. Okay, our 1st theme goes like this: views and understandings of CYC professionalization. So this was the understanding of the child and youth care workers on what do they think is child and youth care professionalization, and do they even see it as something that exists or it's just a myth. Okay, from what I uncovered is I do not find much disagreement on the existence of the professionalization of CYC, as only one participant had denied it and its existence. The majority of the participants demonstrated the knowledge of CYC professionalization as they acknowledged that it involves ethics, education, and training, which results in recognition and better employment opportunities. Hence, the verbative before, it did speak about recognition. The participant did say that they were thinking it will bring more recognition and better employment opportunities. Okay, during my interaction with the participants, I did find out that there are things that have been achieved already in the CYC professionalization. being listed as registration with the Professional Council, education and training for child and youth care, attendance of conferences. The participants did say that with regards to registration of with the Professional Council, the participants did say they're quite excited that right now they are being registered as individuals. Hence, before they were registered along or with or as part of the of the social workers. It's either they were referred to as auxiliary, but then now they are proudly professional child and youth care workers. That's one thing they are very proud about, being achieved with the CYC professionalization. So they're very happy about that, and they acknowledge it as being an achievement with the CYC professionalization thus far. With the education and training for child and youth care, we're quite aware that ECB India and NACCW are doing a great job with training and educating CYC professionals. But now they are more excited that we have universities that are bringing up degrees from child and youth care. So there are universities and institutions that are proudly producing CYC professional graduates. That was one of the things they were very proud to say and very proud to reveal being part of the child and youth care program. The attendance of conference. They were so excited to share that the attendance of conference brings up a lot of knowledge that they can apply when they're back in their workplaces. They're excited that the conferences actually bring a lot of education from different professionals in how to actually handle the challenges that CYC workers are facing during their time or during their work with young people. So that's what, these are the things that have been outlined as achievements in the CYC professionalization thus far. And we're actually hoping to see more of things being achieved, hence the CYC workers are the frontline workers. They experience CYC at first hand. So if these things are coming from them, it's quite exciting. Well, as much as there are things that have been achieved in CYC, there are still challenges that need to be addressed. And the CYC workers mostly spoke about the lack of job opportunities, lack of salary increase, lack of defined roles and recognition by other professionals, delay in the process of registration. Sorry about that. Okay, with the lack of job opportunities, the CYC had mostly complained about that they would really wish to be more employed in governmental sectors than in NGO or private organizations. So they wish to be actually being part of the government's programs and actually receive benefits from the government's program. So that was the lack of job opportunities they mostly complained about. The lack of salary increase. Some of the participants were not so eager to speak about their about this part because to them it's something they hold close dearly to their heart. So it's something that directly affects them. They're complaining that some of them have been working in the field for years and they've been receiving the same salary, which was not something nice to hear. Hence, CYC is professionalized. And the lack of defined roles and recognition from other professionals. That is one thing they mostly spoke about. Their roles, they say that a lot of employing organizations don't even know the job description of CYC workers. They feel that even the families, the young people they work with are actually experiencing the same thing, hence they're being called aunties and uncles. And the saddest part is that even the other professionals in the field, knowing that these CYC workers actually got training like them, they also are treating them that way. So that was not something that was nice to hear, but it was something that the CYC participants had expressed in this study, that they are not really actually recognized, even if they actually got degrees from the universities such as DUT, they also still being recognized or referred to as aunties and aunties, which sometimes lead to them not being part of the developmental plan and implementation or interventions of young people. So that was that. The delays in the process of registration. A lot of CYC or a lot of participants had expressed that they have applied, but then for registration, but then they haven't actually received their certificates. Some are saying that they had to actually go to actually collect their certificates, which was not something that is nice to hear. Hence, CYC is professionalized, but it was something they actually were open to express. Okay, hence having picked up all the challenges and the things that have been achieved in the CYC and during this study, it was actually relevant to actually come up with some recommendations, having observed and then taken everything that the participants have expressed. Hopefully the recommendation that I had come up with for this study might be helpful, and then it might bring change, hence our and hope for the CYC workers, hence our theme for this conference. Okay, the first recommendation is the creation of job opportunity. We would wish for the CYC major role players, our NACCW, our SCARce, our education institution would actually come up together, even the Department of Social Development, to help and create more employment opportunities for CYC workers that are permanent, because they also complain that they are mostly leaving or being employed in contract. So for more job opportunities that are permanent and that would actually still be helping CYC workers to also meet their own needs while also performing very well in the work they do with young people. So the creation of job opportunities is the first recommendation. The advocacy for salary. Also, I'm calling on the major role players of CYC to help advocate for the salaries of CYC workers, because they did complain that as much as they are getting paid, but it's not fair for them to be actually receiving the same pay as with somebody who is not of the same qualification, or of the same degree as them. Some people did get training, which is good, but then the other CYC actually went as far as getting degrees, and now they're complaining, or they're actually not happy that their salary is the same as the other CYC workers they work with. And then maybe the establishing of clearer defined roles and recognition from other professionals. I would say this in terms of maybe before we actually start off with our work or of our employment, maybe every CYC worker, every social worker, every profession that form part of an organization or a multidisciplinary team can actually come together first, discuss their job descriptions, what they need to do and how far they can do it. So everyone would understand their roles, not just the other professions understanding the CYC roles only, but then even the CYC workers understanding the other professionals' role in a workplace, so that everybody would be clearly understanding what they need to do in the lives of young people, in the organization as a whole. So no one will be feeling in fear of anyone or feeling that they are not respected or taking any regard against them. So everyone, maybe that's the job description would actually help before we actually start a working environment. So everyone will know what they need to do. And also child and youth care workers, I'm appealing to them. We need to stand up together. We need to actually be bold. We need to express our job descriptions, because we are the ones who know what we are meant to do. We are the ones with the training. So whenever we get into a working environment, we need to actually clearly ask if they understand what we do, and then we actually need to explain to them, because we are the pioneers of change. So if you want other professionals or the employing organizations to actually respect us and to know who we are, we should tell them who we are in a very respectful and professional manner. And CYCs are very known for being professional. And then the expedience of the process of registration. with this one, it was quite interesting that even before I actually thought about it during the interviews with the participants were mostly telling me that with the process of registration, maybe it would actually speed up if they could employ more child and youth care workers to help with the registration of CYC workers and other social services organizations. So maybe with the experience of the process of registration, it's actually hitting two birds with one stone. If CYC workers can be mostly employed to help with the registration process, the job creation opportunities is being met. So these are these are the recommendations for the study that I had conducted, and I hope they're quite helpful, and I hope someone out there would actually take them into consideration, and also hopefully the other CYC workers would actually comment on them. Okay, my study did have not a lot, but then it did have limitation, and they're mostly COVID-19 related. Hence, having to actually approach CYC centers that can I have an opportunity to actually conduct a study with their CYC workers. It was not actually very much accepted at first because the government had instructed the CYC centers not to actually engage with people who are not from the CYC workers, or maybe people from outside, hence the COVID-19 pandemic, having to protect the young people, having to protect the staff. So that's another limitation that I had to wait until the levels were actually down for me to actually conduct the study. And even so, conducting the study, I had to actually limit the number of participants for the study. Hence, the initial number, I couldn't meet, or I couldn't be accepted in a lot of CYC workers. Hence, I initially did my proposal. But then because I had to work with what I had to actually decrease the number of participants that I needed to include in the study. I had to decrease the number of CYC centers and children's home that I needed to include in the study. So those are the limitations that I had. Okay, this comes to the end of our presentation. Hopefully the audience enjoyed it, and hopefully it was clear enough, and then thank you so much.
Okay, just to wrap up there, to say maybe some people may wonder, why are we saying that this study, because it had some limitations, maybe it's not fitting with the theme of the conference, like maybe children's care workers are champions. We sat and thought about this, and then we actually thought, you know what, with all these challenges, with all these factors that children's care workers have encountered, some of them very negative, they still take care of the children. They still do the best that they can with the children. They're still championing the work that they have been assigned to do and the services to young people and families. Thank you.
Are you still there?
Are you there?
Yes, I am here. I had muted myself so that I don't interfere with your presentation. I just want to say thank you. Yes, you can hear me now.
Yes.
I just want to thank you, Nokwanda and Mirriam, and myself as a past graduate from DUT. This study speaks to me. And I am glad that I hear that This study was on child and youth care workers, and child and youth care workers got to speak and say how they feel about this whole professionalization. I'm glad I hear I hear child and youth care workers saying that they are unique. They recognize that they are unique. Yes, the salary issues, yeah, that it's a long walk to freedom. I think that's where that statement was coined. The better employment opportunities, we can always pray. But I'm glad that we are still studying, we are studying and we are studying and we are training. And but you encompassed everything, I think, practically everything that we are going through as child and youth care workers, whether you're a graduate or you are in training. I do not see any questions from the participants, but your presentation was quite clear and very informative. We could understand, and we are thankful for it. I see Charlene said it was a great and very interesting presentation. Lindelwa said, well done. Dr. Fatima said, thank you for the presentation, very relevant study, well done. Charlene also said, this is an encouraging presentation through the challenges, and yes, child and youth workers are commended for championing. This echoes my sentiments as well. I'm glad there are comments. Since there are no questions, I don't know if there are any other comments, but thank you so much. It is very relevant. I am a child and youth care worker. Yashna says, well done, Mirriam and Nokwanda, explained very well and clear. Echoes my sentiments as well. I'm glad there are comments. Since there are no questions, I don't know if there are any other comments. But thank you so much. It is very relevant. I am a child and youth care worker. Yashna says, well done, Mirriam and Nokwanda, explained very well and clear. Okay, if there are no other comments, and if our speakers don't want to say something else, we will wrap up the session. But thank you so much, everybody, for attending the session. We will move on to the next thing on the agenda. Nicholas says thank you for this information. Thank you, Mirriam and Nokwanda. Thank you very much. I don't know if you'd like to say something.
So much for chairing our session.
Yeah, I just would like to apologize to everybody, guys. We're just learning this, and yeah, there will be some hiccups, and we were running behind time as well. I know the next breakaway is supposed to go into the next breakaway. I'm also not sure if we are going straight into the next breakaway. I'll have to check with the main conference, but if everybody could hear, I think we did pretty well. Thank you so much.
Thank you.
Thank you very much.